I think one of the most important things and the first step in helping any of our patients understand what it is they're going through is to recognise and understand some of the symptoms and get some sort of explanation as to what's happening and why they're feeling the way that they do. Recognising symptoms of anxiety and symptoms of depression and making sense of some of these symptoms and experiences, we can then help them to move on to learn new skills and techniques in managing some of these symptoms. Positive Step has been running for 4 years. We were commissioned at the beginning of 2009 and we're part of the IAP programme, which is the Improving Access to Psychological Therapies. And Positive Step is the primary care mental health service for North Somerset. We offer mainly psychological therapies based on a cognitive behavioural therapy approach in a stepped care manner. Step 1 being working alongside the GPs. Step 2 is when somebody comes into our service and then accesses things like psychoeducation courses, supported self-help and other self-help materials, and a limited number of one-to-one sessions. And then step 3, we have the high-intensity cognitive behavioural therapists, which offer the individual cognitive behavioural therapies. The Positive Step team comprises of a wide variety of professionals with significant background in working within mental health. There's a wide variety of knowledge, skills, training and experience from people who've undertaken counselling courses and now work more within the mental health field, to IAP trainees who are now qualified psychological wellbeing practitioners, through to high intensity cognitive behavioural therapists. Core profession wise, before actually coming into this field of psychological therapy, you may have done mental health nurse training, social worker training, occupational therapist training, all had a variety of experience in working with people with mental health difficulties. Cognitive behavioural therapy is a well-researched psychological therapy approach to helping people with different aspects of mental health problems, mainly depression and anxiety disorders, what was described more as the emotional disorders. The cognitive behavioural therapy is well researched, and there is good clinical evidence to prove that working in this way often helps people with common mental health problems, and also is very helpful in allowing people to work in this way themselves and learn to become sort of their own therapists in order to manage their mental health needs. When experiencing difficulty, especially around feelings of low mood, depression, anxiety, which is having quite a considerable effect on how people engage in day-to-day life and how they experience their day-to-day life. The effect that this can have is that people often feel that they're the only one going through this, that nobody else can understand how they're feeling. And often engaging in psychological therapy, especially coming along to our psychoeducation courses, where they come along to meet people going through similar difficulties and learning new skills and techniques to help to manage some of these symptoms, can be quite empowering. To be able to be with people who are experiencing similar difficulties often empower and motivate people to actually take these things forward, to work on their own mental health issues. Through cognitive behavioural therapy, it helps to identify or make the links between how people are feeling, the sort of distressing thoughts they experience. Like with depression, there's the negative thinking, and with feelings of anxiety, there's what we call the anxious predictions, where the what ifs and worried about the different things that may go wrong in their life. and also it makes the link then with the associated behaviours and the way people behave with regards to how they're feeling and thinking. And by linking these aspects together and working with different techniques within these different areas, we can help people to manage the symptoms of depression and anxiety. There's a lot of research being carried out over the years with the CBT, and the evidence base is that these techniques are very effective in helping to manage symptoms of depression and anxiety. The new website that we have makes Positive Step far more accessible and easier for people who have internet access. By logging onto our website, looking at what we have to offer, by reading through what the service is about, and then looking at what courses are available in the near future, the dates, the times, the venues which are suitable for the person. They're then able to book onto the course by filling in our easy booking form. The first step for anybody who wants to improve their mental health or help to manage their mental health and mental health symptoms, all they have to do is get in touch either through our website and book directly onto a course, or telephone our 0800 number, which then will get them through to a worker to discuss what their needs might be. So by taking that first step, they're on their way to improving their mental health.